Hey there, welcome. I'm so excited to be here for the second edition of the Wise Women educational series. And today we are going to be talking about herbal remedies for the childbearing year. So today I've scheduled about an hour and we're going to be giving an opportunity to share about what you think are the best remedies for different herbal complaints in pregnancy. But before we jump into the topic, I want to say, hey, good to see you all. I just got back from taking a load of hay with my sister. I'm out here in Arkansas. I'm getting ready to teach a workshop here next week, and I'm pretty excited to be here. When I landed last night, the temperature was 9 degrees, significantly different than being in San Diego, but I sure am happy to be here. And so why don't you all tell me where you're from and where you're calling in from, and say hey. Let's see, we got a whole crew joining already. Hey folks, good to see ya. I'm so happy to see ya. So text, where you're from and where you're joining us from. And maybe also, if you can, type a little blurb about what pregnancy complaint or postpartum complaint or baby complaint that you most want to cover today. And I'll see if I can. Okay, let's see. Well, we've got Amy's here from Illinois. Awesome. That's really exciting. I'm out here in Arkansas, feeling the Midwest vibe. Hey, Linda. Good to see you, Wisconsin. Good to see you. And Miss Bliss, my girl from LA. Hey, I want to give a big shout out right now to my girl Bliss. She just passed the NARM. Woo woo. All righty. I see some fun people joining. Let's see. Yeah, tell us about where you are in the world right now, and also what pregnancy or postpartum complaint you most want to check in about. Like, what would you like to cover most today? I have kind of a game plan, but if there's anything you guys want to cover, let me know. Alrighty, let's see. We've got some folks calling in from all over. Ooh, heartburn. Yep, I definitely have that on my list. And those frustrating hemorrhoids. Yep, that's on my list to cover today. Thanks, Amy. Cool. Anyone else have any topics they really want to cover? Oh, hey, Julie, Ronaldo Beach, California. Yay, so good to see ya. Awesome. So if you're just joining, go ahead and tell us where you are in the world right now and what childbearing year complaint you most want to cover today. Hey, Phyllis, good to see you. Alrighty. Cool. Awesome. Oregon. Hey, Jessica. Low back pain. Okay, yeah, I'd love to cover that with you. That's awesome. Thanks for telling me. So I just was out in the cold weather. It's warmed up a little bit, but it's still pretty cold here. It's kind of amazing. Bethany from Tennessee. Hey! So exciting. Let's see. Well, today we're going to cover childbearing year herbal remedies. And so what I was going to do is I was going to cover some basics about herbal medicine, and then I was going to cover pregnancy complaints and postpartum and baby complaints. In terms of herbs for labor and birth, that is a little more complicated, a little less one size fits all, and so we'll definitely go over that in the workshops that I offer. So if you're interested in taking a deeper dive, let me know, because I've got some workshops coming up. So we're getting on noon now, so let me do a little introduction and say hey. Hey everyone, good to see you. I'm so glad you're here. We're getting some people typing some complaints they'd like specifically to go over this hour. So if you're just joining us, go ahead and add some complaints that you definitely want to cover. And then Also tell us where in the world you are right now, because I love growing this community and making this connection. So that's really fun. So my name is Augustine, if you haven't met me before, and I am a midwife. And I am no longer having an active practice, and instead I have switched my focus to midwifing the midwife. So I'm delighted to be able to hold these free little workshop things here online, here on Facebook Live. I also do live workshops in person for both beginning midwifery training and advanced midwifery training. So if those of you are on the midwifery path, make sure and check out my workshop schedule, and that's on augustinecolebrook.com. I'm going to be here in Arkansas next week teaching a workshop, Advanced Midwifery, and then I'll be in Tennessee in March. I hope to see some of you guys. And then I'm speaking at the Indie Birth Conference in Sedona, Arizona there in March as well. And then I've got at least 2 workshops planned in Hawaii for May. So if you'd like to have CEU credits and a vacation, come join me in Oahu in May, and then on Maui the week after. And then if you want to bring me to your area of the country, definitely reach out and tell me, because I would love to come teach other places as well. And I'm starting to put some other appointments on my schedule, so that would be fun. Additionally, I also run Wise Women Consulting, and we are a national consulting firm focused on the business of birth. And so we help midwives, doulas, and doctors expand and grow their practices, and also hope to open birth centers. So I have an amazing graphics design artist on my team, so we can do all of your branding and your collateral development. And then I also have brought a lawyer on my team so that we can also do all your contracts and informed consent legalese. So I'm quite excited about that. So let's see, if you're just joining, let us know where you're calling from. I see a Wisconsin. Hey, Joey, good to see ya. And let us know what topic you specifically want to cover today. Aloha, Leilani from Maui. Hey, girl. So yeah, let me know what you want to cover today. I have an idea of what I want to cover, but I certainly want to meet your needs. And as we go along, I just want to preface and say that I would love to cover this as in-depth as possible, but an hour does not give us that time. And so what today's presentation is going to be is my favorite remedies that I've used over the last 20 years of my career. It doesn't necessarily mean all the remedies that are out there, and you might have had other experience, both personally or professionally, that lend you to have a different opinion about these herbs. So by no means is this the law or the right way. It's just my experience and my practice. So I'd love to have you all add in comments or techniques or your experience, but I'm not going to do an exhaustive review. This is not a how-to workshop either, so we're not going to go how to prepare herbal remedies, but I will talk about where they come from. Alrighty, are we ready to jump in? So exciting. Okay, so if you're just joining us, go ahead and say where in the world you're tuning in from, and also what pregnancy or postpartum complaint you would most like to cover today. Alrighty. So we've got a nice full group today, which is exciting. I'm really happy to be here. Like I said, I'm in Arkansas. I've been just brought in a big load of hay on a flatbed truck with my sister here at the horse farm, and I'm going to be doing a workshop here next week. So if you're in the Midwest, come check me out. Hey, Jackie from Texas, you could come up and see me, come to my workshop next week. You're probably on call or something. But anyway, good to see you all. Alrighty, so let's jump right in. So, oh, okay, great. Thanks, Joey. Oh, we got some comments here. We're going to talk a little bit about tears and Portland, Oregon. Hey there, Elizabeth. I haven't seen you in years. Depression. Yes, we can chat about that too. And I'd love to hear your comments as well. Yeah, okay, thanks for sharing, Elizabeth. And then Jackie, yeah, Maui, yep. Milk production. Okay, yeah, we're going to cover all that. Alrighty, so I'm old. I use glasses now, don't mind me. So the first thing I want to share is about the type of herbs that we do use, how we use them. So there's home preparation herbs that could come as like a tea, and that would be either an infusion or a decoction. We could offer tinctures, infused oils, salves. You can make a poultice. You can go on and make lotions or soaps, all herbally based, and that could all be home preparation. Then we can also use herbs in a commercial level of preparation that creates homeopathics are mostly herb, plant-based. Also, Bach flower essences are obviously plant-based. Essential oils, and then all the extracts of vitamins and essential fatty acids are all in a commercial level preparation from herbs or plant or mineral or animal source. So there's quite a bit. In fact, most of the origins of pharmaceuticals come from herbal preparations as well. But for our purposes, what we can gather and what we can produce, the home preparation or the easily created at home is the only thing that we're going to focus on today. I did say I'd do a whole nother workshop on homeopathic preparation, homeopathic use for the childbearing year, and so that'll be sometime this summer. But today we're going to focus on herbal care. So when we're talking about using herbal medicine, we are talking about using it both in a lot of different formulas. So the bulk dried herb is the most common starting source. So you could get fresh herb too, if those of you are organically gardening or can, wildcraft in a sustainable way. Or you have a source of someone who's doing that, then you could use the fresh herb. But for most purposes, the dried herb is how we start our preparations. Let's see, we have some comments here. I'm going to try to keep up. Andrea, hi. Herbs to help with conceiving. Okay, this was not on my list, but we can try to jump into it as well. Yeah, and that can be a real challenge for a lot of people. So I'll save that to the end, but let's see if we can jump into that too. So from those dried herbs, we can then create various herbal medicine preparations by taking that dried herb and immersing it in water. And that would be like a tea, right? So if you pour boiling water over loose leaf herb and you let it steep for 1 to 10 minutes, you get a tea. You could also take that bulk herb and add it to water, hot or cold, for an extended steeping period and create a decoction. And so the idea being that you pull more out, and different types of herbs are better suited to these different preparations, right? So a very tender chamomile flower and leaf is not really suited to a decoction, versus like a pal de arco root or bark definitely wants to be in a concoction. A decoction is the way that we create that herbal preparation. So these are all different ways, and again, it depends on the herb that we're making to determine whether it's useful or not. We could also take that bulk dried herb and we could add it to alcohol, right? And so an alcohol preparation becomes a tincture. And so there's varying different types of alcohol we could use, varying different lengths of the steeping or the infusing process. But overall, when herb is preserved in alcohol and then strained, that's called a tincture. We could also take that herb and we could distill it or tincture it or infuse it in oil. And so there's oil infused herbal preparations as well. A lot of these make the basis of what goes on to become salves. And so salves is another way that we can create this herbal preparation for external use. You can also take bulk dried herb and preserve it in sugar, a sugar water that's created, or honey, or even you could make this herbal preparation in a glycerin or a glycerite. And you could mix dried herbs with clay to create a poultice. And then you could also lacto-ferment your fresh herbs. So there's a lot of different ways that we can create herbal medicine. So let me just check in really quickly. Is that sounding, do you guys all understand that? Everyone, give me a thumbs up if that all makes sense. And if you had a question about what I have said, ask a question, because I'm going to move on pretty rapidly and I don't want to lose anyone. Getting some thumbs up that that all makes sense. Great. Okay. Yay. Thanks. Good. Thanks, ladies. Great. Alrighty. So, again, those different preparation depends on what it is that you're trying to make. What is it that you are creating? What are you treating? What does that woman need? That all determines the preparation style that you use. Okay. So I'm going to talk about some basic supportive herbs for the childbearing year. It is my belief, and I think it's shared by Susan Weed and many other well-known midwives and herbalists, that there's a certain, that most women need herbal support, and that there is a significant number of women who have liver dysfunction of some kind and need support, liver support. And so I am a firm believer in encouraging herbal consumption just as a supportive, basic blood building, uterine tonic kind of purpose. Certainly it's not required, but I think it does no harm, and it can potentially create some really amazing results for those moms that are struggling. So some basic supportive herbs for the childbearing year is the kind of good old standard red raspberry leaf. That's it's kind of always touted as a supportive pregnancy herb, and I completely agree. You can make an infusion every morning and sort of sip on it throughout the day. The general rule of thumb is 1 cup per trimester per day. So if she's in her first trimester, she would have 1 cup a day, and second 2, and third 3. In the last month of pregnancy, it's kind of unlimited. She can have as much as she wants. So red raspberry leaf is both a uterine tonic and a blood builder. It does impart a bit of iron, and it does help to tonify the uterine muscles so that they can do the hard work of labor. So I'm very supportive of that. Also, nettles and linden and oat straw and alfalfa are all really excellent blood building, tonifying herbs for all of our lives, but especially in pregnancy. And so I'm a fan of that. And then of course, motherwort is kind of the mother herb, and it can be used at any point throughout pregnancy, labor and delivery, and child, babies and all that. So I'm really supportive of those herbs. I will say, however, that unlike what happens in the commercial preparations where they take those and create a blend, so you'll get those pregnancy teas, what that is about is taking all of those supportive herbs and steeping them together. And I kind of discourage that. And instead, what I recommend is brewing 1 type a day. And so if she buys her bulk herb, one day she'll have red raspberry leaf, one day she'll have nettles, one day she'll have alfalfa, another day linden, and so on and so forth, especially in the beginning when she's still learning the taste of what herbs without a bunch of sugar taste like. And also because we want to monitor for any potential allergy. It's unlikely, but allergies are on the rise, and some of these are like clover family, grass family. They can actually cause allergies, and so it would be great to be able to identify that. So if she drinks them one day at a time, then she can at least trace itchiness or, something back to what she was drinking. It's unlikely, but again, I think that's important. And also she gets a taste for it. And, I'm this really big believer that our taste buds are not lying to us, except for about sugar. They always lie about sugar, but about every other taste, things will either taste like very satisfying or very, intense, or, like trying to label the flavor of that herbal preparation can be really powerful in learning yourself, learning what's missing, learning what you need to add, understanding your spiritual and emotional journey in addition to the physical. And because, you know, we're not just physical beings, we need to really tune into those other places. So, like, for instance, I've seen some moms who are really turned off by bitter herbs. And it's like, well, what is that? What should we explore that? Why does bitter turn you off? And if they do some digging, sometimes they find that, you know, they're not really comfortable sitting with bitter sweet or bitter words or bitter cold, right? There's lots of different manifestations that comes out of. And so trying to find out what she's not comfortable sitting with, tasting, being, can really help on a growth edge. And again, this is like way out there, spiritual midwifery. So, you know, if I've lost you, it's cool. But I encourage taking them one at a time. I encourage investigating that, encouraging her to investigate that. And then there's something really powerful about her, like, facing her, like, I don't like bitter, but I'm really gonna, like, savor it. Just like, you know, we don't like being sad or we don't like being lonely, but to really explore it and find out why. So let's see, some people are sharing. Okay, great. Thanks for that. Yep. Okay, yay. Hey, Kathy, where are you tuning in from? Awesome. Okay. Well, so let's go back to our topic at hand here. So, what we're looking at here are some basic supportive herbs for the childbearing year. And so what I said was rose raspberry, nettles, linden, alfalfa, motherwort, oat straw. Those are all great for pregnancy. Some liver support herbs that you might want to add, especially for those moms that look like they need that support. Milk thistle and dandelion are going to be really helpful. When we talked about the types of preparation earlier, I really like to do those liver supportive herbs as a decoction so that they're stronger and concentrated. Yeah, nettles and motherwort. Yeah, absolutely, Leah. Thanks. I like to do them very concentrated so that instead of drinking like a quart of these infused herbs, we're drinking like 2 tablespoons of like medicine. Also, liver detox herbs can also be given as a tincture, which is kind of ironic because it's distilled in alcohol and the liver doesn't like alcohol, but we're talking about tiny, minute amounts. And of course, you can always take a tincture and put it in tea or a little hot water and it'll evaporate most of the alcohol while not losing too much of the herbal constituent. So that's another good way. So moving on now to talk about hemorrhoids. Because that's a really common major pregnancy complaint. I will say I want to include varicose veins in with this hemorrhoid conversation because it's really the same thing. A hemorrhoid is just a varicose vein in the rectum. So it's the same problem. And so they oftentimes go hand in hand. You'll see women who have varicose veins on the backs of their legs and also are having hemorrhoid issues. It's all the same problem, so we should treat the whole woman again. So Bliss, a decoction is an herbal infusion for much longer. So it's a dried herb preparation with water, but for much longer. And so it's stronger. And so like with a tea, you would just steep it with hot water. With a decoction, you actually boil it down. So we do that with roots and various barks and herbs that really need to get the toughness boiled out of them. So let's see. Yeah, there we go. Thanks so much. Oh, we have Amandalia from Israel. Hello, my friend. Good to see you. I'm so glad we've got an international show happening here today. Awesome. Okay. So let's talk about hemorrhoids. So a great remedy is obviously topical witch hazel. Everybody talks about that as being a good remedy. And it is because one of the symptoms that go along with varicose veins and with hemorrhoids is inflammation. So basically, the root cause of hemorrhoids and of varicose veins is that the vessel walls have lost their strength. And so instead of being a smooth channel a river through which the blood flows, the vessel kind of gets pools, and some lakes can form there. And so it's not as fast moving. So we actually have a bit of pooling blood there in the vessels, both either wherever the vessels are located, the backs of the knees, or actually in the vulva or in the vaginal area, or in the as hemorrhoids in the anal area. And so that pooling of blood is obviously warmed, will create some heat. Additionally, it is the swelling from the pressure of the extra blood in those weak areas will cause discomfort, and then oftentimes that will create more swelling, and then we have heat and inflammation. So we want to first take down the inflammation. That's a symptom, but we also want to treat the root cause. We want to strengthen the vessels. And the best source that I've found for that is rutin. And rutin is basically derived from various bioflavonoids, and it's found a lot in citrus. And so rutin is a supplement that you can buy. And it's not a short-term fix, it's a long-term fix. So if a mom is experiencing varicose veins or hemorrhoids, she's probably dealt with it most of her life. And so we need to put her on rutin for a long, long time, like a year or more. But she should experience results, within 6 to 8 weeks. She should start to have less discomfort. So while we're waiting for the actual vessel walls to get stronger, and vitamin E is another one. Vitamin E and rutin are my favorite supporters for that process. While we're waiting for that to get better, then we're also going to do those temporary symptom relief remedies. And that's where witch hazel comes in. Apple cider vinegar is another. And then especially for hemorrhoids, we want to reduce the time where there's any straining, because straining from above will actually continue to prolapse those already weak vessels. And so that's where the fiber comes in so specifically. And so the fiber that I recommend is not bran fiber. I feel like that's actually quite constipating and increases the straining. What we want to add is meat fiber or acacia fiber. Those are both highly processable and actually create bulk as opposed to firm. So we don't want to create firm stools. We just want to create bulky stools, because then that will push the hemorrhoid vessels. It will push them back into the lining of the colon, which is where they should be. And if we have actually protruding external hemorrhoids, then we need that even more. But if they're just a soreness, just an internal hemorrhoids, oftentimes the solution can happen very quickly and we'll get results very quickly. I will say that if your patient has external hemorrhoids, especially bleeding external hemorrhoids, that would be definitely something to refer. And frequently that hemorrhoid or that prolapsed varicose vein has gotten so severe that it actually needs to have surgery. And so that's not an abnormal situation. Obviously, we'd want to treat those conditions way before they get to that. But sometimes you don't get a mom in care until after she's had a significant amount of life living with those painful bleeding hemorrhoids. And so if she comes to you in pregnancy or even postpartum, again with a prolapsed bleeding hemorrhoid external to her rectum, then a referral and then potentially surgery is a good choice. We need to put it back, and then from then on we can support it so that she doesn't get any more. But sometimes it's impossible to replace that vessel, and the risk of an untreated bleeding external hemorrhoid is quite severe. I'm sure you all are aware that we do have deaths in the United States from not being treated. All right, let's see. So some questions for rutin. Yes, it's R-U-E-T-I-N, I believe. I'm a little bad at spelling, but that's what I think it is. So rutin can be very, very helpful. Apple cider vinegar, witch hazel externally, and then changing the diet so that we're both hydrated and have some good fibers to bulk up the stool is going to be really, really helpful. Alrighty, any questions on hemorrhoids? Anything you want to cover? I see that Kristen has a question for fissures. Fissures is when there's actually an opening between the rectum and the vagina. And that is absolutely necessitates surgery. There is no way to heal that naturally, and the risk of infection is significant, as well as the actual loss of function in that woman's life. So a fissure definitely needs surgery. Yeah. Sometimes hemorrhoids go along with a rectocele, and that's a weakness in the rectal colon, and it prolapses into the vagina. And that can sometimes be healed on its own with physical therapy. And so, again, if you discover that cystocele, rectocele, cystocele would be that it goes to the bladder, rectocele that it goes to the rectum. If you discover that, in a postpartum exam with your patient, definitely make that referral to a physician, because that's going to be very, very, very important for her lifetime health and comfort. Alrighty, so we're going to move on now. The next topic we're going to talk about is morning sickness. And so, oh, sorry, Kristen, let's see, you were just commenting. Oh, okay. You're talking about fissures. Got it. Maybe I read it wrong. Yes. So that's just little tearings of the skin. And that would say to me that the stool is too hard and too bulky. And so we would want, again, use that good meat fiber or acacia fiber, stay really hydrated. Prunes can be helpful then. You know, any of those fruits and vegetables that will bulk up the stool and will create softness. And so don't be allured by thinking that carbohydrates and or potatoes create softness in the stool. They're quite soft to eat. Pasta's soft to eat, but it's quite constipating, and it creates a very hard stool. So it's kind of the reverse, really. Like, you know, sunflower seeds, for instance, with the shell on are quite hard, but they actually create bulk in the stool. So that's very, it's misleading, but that's what we want to eat actually harder things in the beginning, because they create softer stool. So hope that helps. Okay, let's see. So now we're talking about morning sickness. So my best advice for dealing with morning sickness is to eat 50 calories every hour you're awake. And that is just kind of the fail-safe solution. And it really means every hour you're awake. So encourage your moms to eat in the night when they're going to get up to go to the bathroom. Encourage them to eat whenever they are up, basically. Even if they're still in bed, they should be eating at least 50 calories every hour. It really changes everything, because as you all probably know, morning sickness is really hunger in disguise. And so they're hungry, but they can't tell that they're hungry. And so you have to break that chain somewhere. And the best way to do it is just kind of a constant flow of little bits. And then eventually it creates the ability to eat again. It sort of short circuits that issue. So the other recommendation, obviously, that's really common is ginger or peppermint. I tend to find that isn't as helpful, honestly. Most of the moms that I know don't get a lot of great response with that. But it's certainly worth a try. I do hear that moms prefer citrus peels, citrus juice can actually be short-circuiting of that morning sickness issue. Lemon balm can be helpful. And then my real favorite remedy is 75 milligrams of vitamin B6 sublingually. So that is broken up at least 3 times. So we would do 25 milligrams, morning, noon, and night. You can even do smaller doses more often if it's helpful. So, B6, a lot of morning sickness is theorized to be a B6 deficiency. And so that can just turn your life around immediately when you take that. It can be an amazing remedy. And if it's not helpful, it doesn't do anything negative. It's flushed out by the body if you're taking more than you actually need. But a lot of mamas feel immediate relief with that. But it's important to know that you have to take it sublingually. Vitamin B6 can't really be absorbed very well in the stomach. So we want to know put it in sublingually, so under the tongue or buccally along the cheek. And the best, cheapest source of it I've honestly found is at Trader Joe's. They have a sublingual B6 blend. You might have a compounding pharmacy in your area. You could also find it at. Alrighty, so any questions about morning sickness? Any comments? Anyone discovered another kind of fail-safe remedy you want to share with us? It's definitely a individual challenge, and it even can be pregnancy to pregnancy. Even if you solve it one time, the next time you're pregnant, it could be totally different. I will say that there is a theory out there right now that morning sickness has to do with your own ambiguity towards the pregnancy. In other words, that you aren't totally sure you want to be pregnant, therefore you have morning sickness. I can't stress to you how much that is false. That is not true. There is no part of you or your psyche that influences whether your body is experiencing morning sickness or not. So in other words, you don't get morning sickness if you didn't want your baby. I don't know who started that theory, but it's wrong, 100% wrong. So just, you know, la la la, and don't listen to anyone who says things like that. Okay, let's see. One other topic that we were going to talk about today is anemia. So anemia can be a challenge for some moms, although I will say that it's entirely overdiagnosed in this culture. We have way too many moms who are being told that they're anemic with iron levels of 10.9, 11.1. That's not anemic, and that's not a worry. That just shows adequate blood volume expansion during a healthy pregnancy. So make sure you're talking to a midwife about your actual iron levels, because comparing your iron levels to a 45-year-old man's iron levels is ridiculous. They're not supposed to be in the same category, and so it is very individual. But let's see. I do have some ideas. Number one, I would say that Floradix is probably my go-to. It's probably every midwife's in the country's go-to. It's the most wonderful preparation. It's a German-made liqueur or liquid, and it is its primary ingredient is docks, I think, the burdocks and yellow dock family, and raisins. And so it's made into a liquid herbal preparation, and it is quite sweet, quite concentrated. It is vegetarian. I do encourage you to buy the Floradix liquid iron plus herbs yeast free. So there's no reason to add any yeast to a pregnant woman's body. She's dealing with fighting it off enough. So make sure you buy the yeast-free brand. But that's a really easy, affordable, efficient way for moms to supplement their iron levels. It's also mass-produced, so you can be fairly assured of quality, and you can find it at just about anywhere. And so for that reason, it's my favorite. I think there are other herbal sources or medicinal sources of iron that can be absorbed better, but they're a little harder for the brain or for accessibility. For instance, like Joey's saying, chlorophyll. Chlorophyll can work. You need to take vitamin C with it because iron can't be absorbed without vitamin C. So that can be useful, but especially for some mainstream moms, it's a hard one, I think, for them to fully grasp. Additionally, I would say the most absorbable form of an iron supplement is desiccated liver, and Standard Process is the company that produces that the best. But again, that is outside of many moms' comfort zone, and they would not willingly consume a pill made of bovine liver in the mainstream world. And so, although I think it absorbs better and I think it's a really great supplement, it's going to be harder for some folks to take. Yep, so we've got some seaweed options. Those can all have good results. I totally agree. Again, there's lots of options out there, and you'll know your consumer base best to know what they're really willing to use. My advice with, let's see, Joey's asking a question. What did you say? Yeah, Joey, I would just say don't take it on an empty stomach. Take it with vitamin C. and maybe she's taking too much. So my advice with Floridix is, again, to let the taste buds rule. So if it tastes good, it is good, and you can basically take as much within reason as tastes good. And as the iron levels rise, the mom's taste for it goes away. It starts to taste metallic-y, and they don't love it anymore. And in fact, if you offer it to some moms, they'll be like, ugh, that's gross, I'm not going to take that. Their iron levels, although they may be low, might actually be normal for them. So again, follow those taste buds. And yeah, I'm sure there are other manufacturers of liquid iron supplements. The main thing is to look for ferrous gluconate, not ferrous sulfate, because ferrous sulfate is virtually unabsorbable in the human body, whereas ferrous gluconate is. So that is my anemia thing. And again, remember that most women that are told they're anemic are not even anemic. Yeah, that's a whole nother topic on of itself, but definitely do your research. And I appreciate Anne Fry's diagnostic test book for their list of appropriate and acceptable iron levels. And I'm sure you have other resources you all like too. All right, let's, burdock root tincture, that would be very high in iron, but there are some moms who will not put that past their tongue. The taste buds are too strong for that tincture. So again, try to find what will work for your moms. I think Floridix is the most universally acceptable and appropriate product that the mainstream mom could buy and use. But I'm not opposed to other techniques if they work. Alrighty, so I also want to chat really briefly about leg cramps. This is a common concern. Common concern for moms dealing with pregnancy, and leg cramps are almost always the result of a magnesium-potassium deficiency. So that's what we give. Just make sure that when you buy your calcium, magnesium, potassium is a rider along with it, and it usually goes on a 5-3-1 ratio, and that's really rough, but it's a good way to tell if it's working out. So recently I've been seeing the CalMag blends have vitamin D in them, which is not bad. That's a nice addition, but we've got to have potassium. So they're all in milligrams, I believe. I'm not looking at any containers right now, but I'm from memory. And so you want to have 5 times the amount of calcium, 3 times the amount of magnesium, and 1 of the potassium. So when you're giving her dosages, try to figure that out. The only bad thing that will happen is that magnesium is a stool softener. So if she is taking more than she actually needs, she'll start to get loose stools. So just be aware of that. And I usually start them out on like a powder of those 3 supplements, and then do like a teaspoon, and the next day a tablespoon, and the next day 2 tablespoons, and until she gets loose bowels, and then she backs off one dosage until she can get at the highest dosage that does not cause loose bowels. And that would be her dosage for the rest of the pregnancy, unless loose bowels return, and then she's stabilized her levels and can decrease. Yeah, Aaliyah, I do like Calm, the brand of calcium magnesium, but it doesn't have a potassium rider, so you have to take potassium separately. There is a way to make a really good calcium, potassium, magnesium like broth, basically, and it would be the vegetable peelings of about 2 pounds of vegetables. So if you were going to make a big stew, you just rinse and save all the peelings, and then save the stew bones, and then you'll make a nice broth from all of that, adding sea salt, and that should have a good amount of these supplements as well. So I like the brand Calm, though, quite a lot, and you just need to add a potassium, if I remember correctly. Vitamin E can be really helpful with leg cramps. Also, keeping your electrolyte balance up, keeping your hydration up, that can all influence the amount of leg cramps. And There's also a couple products on the market that are a magnesium oil, and this would be a topical application. And the reason I love this is especially for women that are quite sensitive to magnesium, and they start to get liquid diarrhea right away. This means that you can rub the oil on the skin where it's absorbed, and then they're getting that without causing the bowel disruption. And so that can be a great source for moms. They rub it right on their calves before they go to bed or coming out of the bath, and they really experience tremendous relief. And you just search magnesium oil. As far as I know, there's only online ordering sources. I haven't seen them in any health food stores, but potentially that's changing. I think Ancient Minerals is the brand that I like. They also make a magnesium bath salt that you can, take a bath with, which again, your skin will absorb a significant amount of magnesium. So that can help with the leg cramps. Alrighty, so let's jump in and chat a little bit about heartburn, because that is definitely a complaint of pregnancy. And probably my number one remedy for the heartburn is chia seeds. They're the most portable and potent solver of this issue. So chia seeds, from that old cha-cha-cha-chia pet thing from when we were kids, we've all gotten smart and stopped using it as decoration, and now it's a food source, which is great. Chia seeds has an incredible amount of essential fatty acids. It's a dietary fiber source as well. I have a blog post about heartburn on my website, AugustineColebrook.com. You have to scroll down through the blogs, but there's a thorough blog post about heartburn. And chia seeds, there's a whole description about why they're great. And so you just carry the loose seeds with you, and when you experience some heartburn, you just swallow down a spoonful, a handful, a pinch, whatever you feel like doing. You can drink a little water with it, or they can just go crunch, crunch, crunch and down the hatch. I don't want to rehydrate them in liquid, because what they're going to do is actually absorb the stomach acid. That's why they work so well. And then you get some added nutrition from them as well. So chia seeds can be an awesome, awesome solution for heartburn. And then I also like raw almonds. It has an enzyme that can denature some of the acid in the stomach. That can be a nice thing to carry around, get some added protein. And slippery elm bark powder is probably my favorite nighttime remedy. So you'll need to go to a health food store to buy this. It's slippery elm bark, and then they take the inner lining of the bark and create a very, very fine powder with it. And you take that powder and mix it with about a little teaspoon of honey, and you make like a paste. You mix it around, this teaspoon of slippery elm and a little teaspoon of honey, and you make a paste, and then you just kind of gum it down. And it's sort of sweet and chalky, so it's not disturbing to the pregnant woman's palate, and it just puts out the fire like nothing else. And so the middle of the night, or going to bed remedy, I would say, is the slippery elm. It lasts for a good 3 to 4 hours, so it can at least get you back to sleep, which is really nice. And I really appreciate that remedy, again, for the night times. Papaya enzymes, some moms use that. That's another remedy that can work well. There's some old wives' tales about salads or refrigerated potatoes or milk or all kinds of things. I don't find that those are as effective as these remedies I've already said. But I will say overall, one of the most important things that could be done is a trip to her chiropractor to examine whether she has a diaphragmatic hernia. So the esophagus flows through the center of the diaphragm, and then the stomach is situated right below the diaphragm. Well, as the pregnant uterus grows up and pushes on that stomach, it can sometimes push a pouch of the stomach up into the diaphragm. And so instead of the diaphragm acting along with the sphincter of the esophagus to keep the liquids in the stomach, some of the liquids are trapped up in the esophagus because of the location of this pocket in the stomach. So this is called a diaphragmatic hernia. And it is an easy solution for a chiropractor to solve. There are some naturopaths that also know how to do this. I've trained some midwives to do this because I learned it from a chiropractor. But you can just also encourage the mom to do long downward sweeping strokes right below her rib cage on the right side of her body, and she can sometimes create some relief herself. So this is oftentimes an end of pregnancy concern or development, and it can be life-changing when you solve that trapped part of the stomach and get it back down with the rest where it needs to be. Let's see, we have some comments here. Yeah, chia seeds are awesome. Yeah, licorice can be helpful, but usually the only way we consume licorice is with sugar, and sugar can make heartburn worse, so I try to avoid that. Yeah, I think there are some amazing drinks with chia seeds. Mama Chia is that new brand that's come out with all kinds of drinks, and now we have kombucha soaked in chia seeds, and all of that is for the nutritional benefits of chia. But to get the benefits in the heartburn, you want it to be just the raw seeds, because they go down whole and then they absorb the liquid in the stomach, the acid, and that's what stops it from creeping up the esophagus. So great solution. And again, always get that diaphragmatic hernia checked by a provider who knows how to do that, because that can change everything. Alrighty, so that is kind of my list of pregnancy complaints. Unless you guys had any others you wanted to cover, we're going to jump into really quickly talk about labor. Induction is a whole huge topic on its own. In fact, I have a 90-minute workshop on choosing induction methods. But overall, I would say my favorite herb for induction is cottonroot. I feel like that is the most effective. Blue and black cohoshas, I think, are not effective the way they used to be 20 years ago. So I'm a fan of cottonroot. And dates, of course, we've read that study out of Israel that the dates, consumption of a date once a week, the last week of pregnancy, do bring about a more term labor. So that can be another thing to recommend your moms consume dates. There is a Jamaican cumin drink that I've seen be effective before. I can't say I've used it a lot, but I learned it when I was practicing in Jamaica in '99. And it's basically like boiling water over a teaspoon of cumin powder with a cube of raw potato at the bottom. I know. And you drink the hot cuminy liquid and then chew the raw potato, and you go into labor within 6 hours. And I've seen it be effective several times, so why not try it? And then, of course, the old standby castor oil can really work. There's controversy with it, and certainly it wouldn't be my first choice, but that is an herbal remedy that does work. Stalled labors almost, if they don't happen because of fear, which is oftentimes a reason why we have stalled labors, or malposition, which is also a reason why we have stalled labors, which is a whole nother workshop, then I would say they almost always relate to a cell salt or an electrolyte imbalance. And so what we want to do is right those imbalances. So the easiest, most culturally appropriate way is an IV with lactated ringers. But if that's outside your scope or your patient doesn't feel comfortable with that, any kind of electrolyte type drink that you can create, herbally based, or even mainstream Gatorade is going to help if she can keep it down. And then a pretty hefty dose of calcium magnesium blend can also create the communication in the cells, right? Because we need those cell salts to take the electrical communication. And so the uterine muscle may not even be getting this signal to contract because it doesn't have enough cell salts. And so the electrolytes and then the calcium magnesium can really make a huge difference in the strength of her contractions and can right that really dysfunctional labor. So always carry CalMag in your birth bag, and definitely a labor aid of some kind if you aren't going to be carrying lactated ringers or even addition to, and don't hesitate to give that liberally in labor. Dehydration is the biggest reason for dysfunctional labor pain and labor progress, I would say, and so those can all be really helpful. Yeah, Bliss, it relaxes muscles that are hyperfiring, but it also helps the muscles communicate. So we have that restless leg syndrome, or the leg cramps, Charlie horses, is because the muscles are hyperfiring. But the same thing is happening when they're lax and they're not firing at all. So that's why it's universally used. Yeah, Joey, let's see. What are you saying? Yeah, probably, Joey. I haven't done a whole lot of research into that, but if you have, definitely share it with us. Alrighty, so so that's kind of my overview for labor stuff. There's not a lot of avenues to use herbs in labor, because herbs are usually longer acting than the labor is, and so homeopathics are a much better topic for labor. And so when we go over homeopathics in labor in the summer, we'll talk a lot more about that. So let's move on to postpartum now. Engorgement is a problem a lot of women struggle with. These are some pretty standard remedies. The cabbage leaf out of the fridge, or creating a grated poultice with refrigerated potato, and then grated, and then you put a poultice on the sides of the breasts that are quite sore, that can draw out some heat. Grated refrigerated potato can also be a great poultice for the rectum during hemorrhoids. It draws out the heat. And in fact, I've even recommended moms whittle a little potato butt plug. I know it's so out there, but it really works because it puts pressure on those swollen vessels and it draws the heat out. And anyway, I'm one of those crazy midwives. Okay, so engorgement, thyme, sage, and parsley are all antigalactagogues, so they're going to help to decrease production. This wouldn't be long-term use, but for days 2 through 8, while your body thinks you had 4 babies, not 1, that can be a helpful time. And then obviously the expressing just enough for the baby to latch, and lots of nursing. That's the best way to deal with engorgement, in my opinion. I do want to encourage all midwives and lactation consultants to, stay away from the pumping early. That seems to be a common lactation consultant recommendation. And the breasts work on the law of supply and demand. So whatever is demanded is supplied. So if we continue to pump it out, the body just makes more, and it just exacerbates that engorgement cycle. So try whatever you can to discourage her from pumping when her breasts are very full in those first few weeks, first few week even. After that, it's a different mechanism. The body, then if it's engorged, usually it's because the baby has decreased nursing, or the baby's having problem transferring, or different things like that, which could be, a tongue tie issue or lip tie issue, or it could be, failure to thrive, or, something like that. So that's not true later on. But initially in the first week, pumping really does not solve the problem, and it can actually make it worse. Okay. So we oftentimes then will have the opposite problem, which is problem with milk production. There's quite a few amazing galactagogues. Those are herbs that help with milk production. Milk thistle and blessed thistle probably being the top among those. Goat's rue can be really helpful. Fenugreek can be really helpful. Anise, caraway, dill, all those seeds can be really, really helpful. Fenugreek as well. Borage can be very, very helpful. Hops is another great one. That old midwifery adage, nurse your twins on beer. You don't actually give the twins beer, but the mom gets the beer and she makes more milk. And that's absolutely true. And all you mamas who've had a beer the night before and suddenly wake up really full, that's true. It is a little delayed. It's about a 12-hour delay. But I will say it must be a very hoppy beer, so Budweiser doesn't count. It has to be a really good, microbrew hoppy beer. And I will also say a little caveat to this, and that is that while hops does increase milk production, alcohol decreases the milk ejection reflex. And so for moms that have long-term issues, this is not a long-term solution. Like if we have a failure to thrive issue, she has to get her hops a different way. She can't get it through beer because she will make lots more milk, but the baby won't be able to transfer it. But just for, babies having a growth spurt and you want to kind of catch up with baby's needs, it's a great solution because you probably got a really voracious, strong nurser at that point, and they'll get out what they need. Another one is barley water. You just soak the barley before you go on and boil it and eat it later, but you consume the water. Not super tasty, but you can add some of the other herbs to it. One of the newest, most lovely way to increase milk production is the breast milk cookies. You guys have probably seen all the recipes online. It's an oat-based, which is a slight galactagogue, but then it has all of these herbs in it. And the more creative ways you can find to do the infusions, either in the butter or in other ways to get those herbs into the cookie, the more effective they're going to be. And I've even heard reports from women who consume breast milk cookies and are not breastfeeding and feel slightly fuller and engorged the next morning. And absolutely, these are galactagogues. They're going to have a direct effect on the milk ducts and milk sinuses, so they're really, really effective and helpful. There's a million recipes online. Just look up, breast milk production cookies or whatever. Alrighty. After pains can be a real pain for those mamas who've had more than one baby. My favorite remedies for those are catnip and cramp bark and black haw. You could make a tincture of those together, or they could be taken individually. After ease is that famous Wish Garden brand herb that most people get for their after pains. And I've heard some recent reports that it's causing some pretty intense gas with baby. So I didn't see that myself, but I would say, obviously, if you're noticing a connection between baby's health and what you're taking, discontinue. And maybe just take the herbs singly. Oh, I know, right, Jackie? I'm so ridiculous. I talk about potato butt plugs on Facebook Live. That's me. Okay. Glad I'm giving you a laugh. That's what I aim to do. Alrighty. So, let's talk a little bit about vaginal or perineal pain and healing. That is a huge topic. We know that 30% of women experience a tear in pregnancy or in birth, and sometimes more. And so we'll want to have good remedies for them to treat that. Plain salt water, sea salt water that you make can be really, really helpful. Just rinsing the bottom with that really alkaline sea salt water can be really healing and really feel comfortable. You could also go on and make a whole infusion or decoction to rinse her bottom in, known as the sitz bath herbs. And the common herbs for that are comfrey and plantain and yarrow and calendula. She might also add arnica flowers or rosemary, lavender, rose hips have a lot of those bioflavonoids and the vitamin C that can help the bottom heal quickly. And all of those can be really helpful in healing. Some people put raw honey on the open wounds. I would say I feel a little bit on the middle of the road about this. I don't think there's any harm in that. It's really messy. But there can be live spores in honey. And so in an open wound, perhaps we don't want to grow botulism, something like that. Again, really unlikely, but these are the things I think about. And, I think if you're using the cooked boiled down honey, first of all, half the chances that it's corn syrup and not honey anymore with the, illegal honey manufacturing we have happening. But also, then it doesn't have all of the healing properties because the raw honey is what's so effective. But I would just be cautious about a raw open sore. If the stitches were done up and all that, maybe it's an appropriate thing, but then maybe you don't need, I don't know. I would say, the herbs are the best bet. The sea salt is the number one, easiest, most applicable thing that anyone can make in their own home. And again, even if it's a super mainstream family and they don't even have sea salt, table salt will create a really nice bacterial static water, warm and soothing to bathe her bottom in. So that can be a great technique. Okay, so moving on here, we're just going to talk quickly about baby or mommy gas. Gripe water can be amazing with that, and that's barley and fennel seeds soaked. Probiotics are going to be amazing for either of them. They sell a baby Dophilus, which is like powdered acidophilus that the baby can be you can just dip your finger in it and then put it in the baby's mouth, and they just get little bits. You can also put some on your nipples. That'd be good for bioflora on your nipples. And then, of course, the way I recommend to purchase probiotics is to buy the smallest container and the refrigerated section, and every time you go back, buy a different strain. So Lactobacillus and Acidophilus and Reuteri and all of the different types that they sell individually. Try to get a different one each time you go to the grocery store, because we don't want to get the bulk containers. They're going to potentially a lot of the live organisms will die before you actually take them if you get very large containers. So we want to get small containers that are rotated regularly. We want to get them refrigerated, and then we want to keep them refrigerated when they're home because they're a live organism. And then we want to change varietals, because the real sign of health is to have lots and lots of different types of gut flora and fauna that help in all of the multitude ways of immune development and food digestion. So lots of different strains, as many, like, don't just buy the same brand and the same strain. Buy different brands, different kinds, and just get as much variety as possible. I will also say that lacto-fermented foods is, of course, one of the most awesome ways to get those different bacteriums. So you can make sauerkraut on your counter. Maybe your community does like kimchi, kefir, coconut kefir, beet kvass, yogurt, all those different traditional foods. In Hawaii, I learned about the traditionally fermented poi. And basically any cultural, connection you can find to, and food that you like that's lacto-fermented. Kombucha is another. You find out how to brew that at home, because it's quite simple. There's a really fabulous book out there called Wild Fermentation, and that goes through a lot of recipes for how to ferment your fruits and veggies at home on your counter. It's called lacto-fermenting, and basically using good clean water and sea salt with your various vegetables or herb products, the sea salted water will pull the lactic acid out of the air, and that's what lacto-ferments. So lacto-fermented veggies and whey fermented coconut kefir or kefir or yogurt. Again, tremendous for the diet, tremendous for the gut. It's going to be so health creating, and you feel really great. And also, again, I much prefer to take a food than a pill. So I encourage you to learn how to ferment at home. And those can all be amazing solutions for that mama or baby gas. And of course, bone broth is so healing to the intestinal lining that if your baby's eating foods already, that would be a great first food. And certainly for yourself, bone broth every day. That's my little reel there. Constipation, again, same kind of thing. Bone broth is going to be really healing. Probiotics, that meat fiber, acacia fiber, rutin, lemon can be really great to deal with constipation. Prune juice, coconut oil, and then senna. And of course, there's that over the counter tea called traditional medicinals, smooth move tea, and that's primary ingredient is senna, and it works really well. Just make sure you take it in the morning. You don't want to have to get up to go potty, and that can be really efficient. Alrighty, so we're just nearing the end. I've got two last topics I wanted to cover with you, and that is depression and anxiety. This can be a real challenge for both pregnancy and postpartum. There's a huge amount of things changing in that woman's life. It usually means a massive change in her relationships, and her relationship with her mother, her relationship with her other children, her relationship with her partner, friends. Everything has a massive change when we add someone to the family. And so supporting her through those challenges. Most women will come with those challenges already. but sometimes they're identified in your care. And so having some herbal support can be amazing. Although I will say, big disclaimer here, although we deal a lot with holistic health and midwifery, and we help women through lots of healing, mind, body, spirit, mental health is truly outside of our scope. So if you're dealing with a client who seems to be presenting or reports true mental health issues, I highly encourage you to bring a mental health care provider into that team. So you'll stay her primary care for her pregnancy, but she will also attend or get support for mental health from a therapist, psychiatrist, or psychiatrist. So I really, really recommend, again, I can't recommend that enough. I can't tell you how many times I've heard of midwives in over their head with women who truly do need support, diagnosis, and oftentimes treatment. So that being said, these herbal supports do not take the place of mental health support and therapy, but they can be helpful for women that are dealing with transient, transitional issues of becoming parents. So St. John's wort and motherwort are really traditional support herbs for depression. Also, catnip can be very helpful, especially if the main complaint is that they just can't turn their brain off. That is catnip's just brilliance. It does the opposite of what it does to the cat, right? So we know of catnip because it makes them kind of hyper and crazy. For mamas, it does the opposite. It really calms them down. And one of the most wonderful things is that it turns off the mind chatter. So I recommend that even to midwives, so that when you get home from a birth, you stop charting in your head and you can finally go to sleep. And then also we know that fish oil, especially with EFAs and DHEAs, can really help with depression because potentially there isn't enough myelin sheath in the brain. So recommending butter and coconut oil and beef fat and duck fat, that can be so important in covering the myelin sheath so that she's not depressed just for lack of nutrients, right? So that's an important thing. And saffron is actually undergoing some studies right now to treat depression, and it's having some good results. And green tea. Green tea can be a really nice stimulant without, and it simultaneously helps to calm. It's a funny herb the way it works that way. So green tea can be useful. And then lastly, anxiety. Anxiety and depression get lumped together, but they're actually two completely distinct issues, and they oftentimes do not occur together. So a mom might be anxious but not depressed, and vice versa. And they need different types of herbs. So for anxiety, a passion flower can be one of the best solutions. I've loved passion flower over the years, giving it to moms. Valerian is a really common herb for that. There is a glycerite version of valerian that's not in a tincture form of alcohol, and that can be really received a lot better because valerian is quite strong tasting. So that can help with moms actually taking it. Again, I do love motherwort for all issues. It is the mother herb. It helps us feel mothered. And chamomile and lavender and lemon balm can also be a lovely blend for anxiety issues. So that brings me to the end of my pregnancy issues. I did see a post for insomnia. Insomnia issues, valerian can be wonderful for that. And hops can be wonderful for that. I think most of the herbs I mentioned for anxiety can also help with insomnia. So yeah, I'm really a fan of that, passion flower especially. Well, I hope that helped you all have a starting point for the herbs that you might use for yourself or your mamas during the childbearing year. And I'm going to post this on my YouTube channel, and it'll also eventually find its way to my website. Again, I am doing advanced practice midwifery trainings around the country this year. You're going to find me in Arkansas next week, in Tennessee in March, and in Hawaii in May. So love to see some of you at those trainings. And I also do consult around the country for those of you who are new midwives setting up your practice, or those of you who are wanting to open birth centers or expand your practice. So feel free to check out my offerings there. So you can find me on the web at augustinecolebrook.com. I'm on Instagram at Art of Birthing, and of course here on Facebook. It was lovely to have this wonderful day with you all. Big hugs, thumbs up signs, and hearts for all of you too. And I'm going to be speaking in January again, and look forward to figuring out a great topic. So if you haven't told me already, go ahead and let me know what topics you'd like for me to present on. This Wise Women educational series is always free, and feel free to share it with the other midwives in your life. All right, lots of love to all of you, big hugs, and appreciate your support. Alrighty, have a great day, ladies. Bye-bye.